This is a video on the pre-operative instructions for any procedures done under anesthesia at Aspire Fertility Center, HSR Layout, Bangalore. Usually, once the procedure is scheduled, a date and a time would be given to you by the doctor or the attending nurse. It's important to know what time you're supposed to arrive at the hospital and be on time. Fasting from 10 p.m. onwards the previous day is preferable, and this timing would be mentioned to you by the attending nurse or the doctor. It's desirable not to wear any nail polish, any jewels or perfumes on the day of procedure. Do kindly inform the doctor or the attending nurse of any previous procedures or operations during which you have had any allergies or medications or otherwise. You should be preparing your private parts. Clean shaving of your private parts is desirable. Consent forms are always to be read thoroughly, signed and handed over to the attending nurse. Do carry 2 sanitary pads with you in the event of any spotting or bleeding post-procedure. There should always be an accompanying responsible person along with you. This could be your spouse, your friend or any of your relative who can take care of you when you are drowsy post the procedure. Kindly arrive at 8 a.m. at Aspire Fertility Center on the day of procedure, unless there is some other time specified by the attending nurse or the attending doctor. There is always a detailed prescription on the procedure date and a timing. Please make sure that you go through your prescription thoroughly and understand the timing. Usually these procedures are daycare and you might have to be in the hospital for 4 to 5 hours, unless the recovery takes a little longer, in which situation you might land up staying in the hospital slightly longer. It's always prudent to take complete off from work or not keep any important decisions to be taken on that day. If you are on thyroid medicine, make sure that your thyroid medicine is taken early in the morning with very little sips of water. Kindly inform the doctors and the attending nurse if you are on any long-term medication, especially for diabetes, hypertension, asthma or any other medical illnesses. Make sure that you speak to the doctor very transparently about your previous illnesses, because this has a bearing for anesthesia. Kindly do the blood workup prior to the procedure. These are extremely important measures for the type of anesthesia to be decided and for also safety of the procedure. The attending nurse or the doctor will give you a list of tests that needs to be done prior to the procedure. Once admitted to the hospital, the attending nurse might go ahead and put an IV line. It is a small injection that goes into your arms, either right or left, depending on whichever side the IV line is easily visible. This helps in maintaining your saturation, maintaining your hydration, and also helps easing the administration of medications during anesthesia. The nurse will also be administering antibiotic, which usually is given after a test dose. If you have any antibiotic allergies, it would be a wise thing to bring it to the attention of the attending doctor and the nurse. After approximately an hour or two post the procedure, the nurse might ask you to consume fluids to see if you tolerate orals well. Avoid spicy and oily food for the rest of the day. Your discharge is usually after you tolerate a meal and you are completely up and about. At the time of discharge, you will be handed over a discharge summary, which is going to have the details of what procedure you've undergone and the outcome of the same. Any medications that are prescribed needs to be taken diligently, and next visit date needs to be followed correctly.